Hi, my name is Courtney, and for my skill today I'm going to be doing the Sterile CVC dressing change on my patient. So I've came into the room, I've gathered all my supplies, have them all set out, explained to my patient what I'm going to be doing. I've checked my doctor's orders to make sure that I have an order to change the dressing, and also that per facility protocol, today is the day that I need to change the dressing. I'm going to come into the room with my supplies, check my patient's name wristband to make sure I have the right patient, have them repeat their name and birth date back to me to make sure I have the right patient. So I've explained what I'm going to be doing. I have all my supplies, make sure I have the orders, the right patient, make sure the patient doesn't have any questions before I begin the procedure. So I've done all that. Next I'm going to just check the site before I take the dressing off, make sure there's no drainage seeping through, no redness, swelling, warmth, pain, anything like that going on with my patient before I take the dressing off. So I don't see any of that, so I'm going to go ahead and get all my supplies ready here. So I'm going to open my supplies in a sterile fashion. So I have my Tegaderm. I have my sterile 2x2. I have my ChloroPrep. And I have a set of sterile gloves here and out in our package. So next, since I have everything open, I'm going to go ahead and put my clean gloves, or first I'm going to loosen up my dressing from the inside, or from the outside towards the middle, just to get it loosened up before I go ahead and put my gloves on to take it off. So I've loosened up my dressing. I'm going to go ahead and put my clean gloves on. And I'm going to finish removing that dressing. So I've removed my dressing. I'm going to make sure to document if there's any drainage on my dressing, or if there's any drainage, redness, or anything around the site itself, any drainage or anything like that. I'm going to note the type, odor, color, and amount of drainage, if there was any on my dressing. So since I'm done that, I'm going to take my gloves off with the dressing inside and discard of those. Let's situate this a little bit better here. And then I'm going to go ahead and use my Purell to wash my hands. So I'm going to make sure that I don't turn my back to my sterile supplies or my patient with the open insertion site. I'm going to go ahead and put on my sterile gloves. I have a lot of room here. got my sterile gloves on. As you can see, they didn't go on the best, but since I'm still sterile to sterile, I can go ahead and fix those. So I'm making sure to keep my hands above my waist. I'm going to go ahead and get my sterile glove on. So next off, I'm going to go ahead and I'm going to get rid of this paper. And I'm going to start by cleaning. So I'm going to take my ChloroPrep. To activate it, I'm just going to squeeze. So don't squeeze towards the patient, not towards myself, away. Go ahead and activate it. So I'm going to clean around my insertion site, just using friction. So I'm going to go on one side, around the bottom, up the other side. And then I'm going to go ahead and contaminate the pinky of my left hand to lift up the lumens and clean underneath there as well. So I've cleaned all 4 sides. So now my left hand pinky is contaminated. So now I'm going to get rid of my ChloroPrep. Next I'm going to take my 2x2 and I'm going to put that right on my insertion site. Next I'm going to take my Tegaderm. And I'm going to take the side that has the crease in it, and I'm going to put that over the top of my lumens. So I'm going to stick that on. Take off my outer edge, making sure that it sticks down. And on the outside of this, I have a piece of tape, so I'm going to, once I get everything else done, I'm going to date, time, and initial that. Make sure my dressing looks okay. So now I'm done with the sterile part of my procedure, so I'm going to take my gloves off. I'm going to Purell my hands. And then I'm going to go ahead and date, time, and initial. And I'm going to take that piece of tape and just stick it to the outside of the dressing of the Tegaderm. So that's on the patient's, on the Tegaderm, not on the patient's skin. Okay, and then I'm going to go ahead and I'm going to take a piece of tape and I'm just going to make sure that my lumens are taped down so that they're not flopping around up here on the patient and everything to keep that site stable. So as I am going back to go do my charting, I'm going to make sure that I charted the date, the time, the orders, the procedure that I performed, if there was any drainage on my dressing, any swelling, anything like that going on, making sure my sutures are intact. There was no skin breakdown from the dressing, you know, from the tape of the dressing. Just anything that, making sure any redness, anything out of the ordinary, I make sure and chart. So I'm going to make sure that my patient is comfortable, reposition him or her, make sure my bed is in the lowest position, patient has a colic, don't need anything before I leave the room. I will clean up my supplies and then I will go and do my charting.